Welcome to Mid-State Technical College. We're delighted to share with you our collaborative initiative entitled 3 Missions, 1 Project. My name is Dr. Bobbi Damrow, and I serve as the Vice President of Workforce Development and Community Relations here at the college. Come along inside of our beautiful Wisconsin Rapids campus to hear a little bit more about our project and our college. Mid-State is one of the 16 colleges in the Wisconsin Technical College system. We offer associate degrees, technical diplomas, certificates, and training in industry credentials and a variety of high-demand occupations. With Wisconsin campuses in Adams, Stevens Point, Marshfield, and Wisconsin Rapids, the college district represents a resident population of approximately 171,000 people and serves approximately 7,000 students each year in our in-demand career programming and lifelong learning opportunities. Mid-State's supportive environment, state-of-the-art technology, and faculty with professional experiences in the fields they teach provide Mid-State graduates with real-world skills, knowledge, experience, and confidence they need for an in-demand career. 9 out of 10 Mid-State graduates are employed within 6 months after graduation. Like many communities in our nation, our district is faced with a shortage of healthcare professionals. Economic modeling shows the current number of allied health practitioners representative of Mid-State's programs will experience a 23% workforce reduction over the next 10 years. This is predominantly due to the retiring labor force. These data, coupled with an increased demand for healthcare services associated with the ongoing aging population, is a challenge we seek to help overcome here at Mid-State. This impending situation led the college to collaborate with our local hospital, Aspirus Riverview, and local charitable organization, the Legacy Foundation of Central Wisconsin, to embark on a project that embodied each of our missions and service to our communities by training more highly skilled healthcare professionals to serve our communities through state-of-the-art interdisciplinary healthcare simulation. This center located within our own local hospital. We are excited to share more about this project with you today. You will hear next from several people involved in our project and how 3 organizations blended the missions to develop Mid-State Healthcare Simulation Center located at Aspirus Riverview Hospital. We will describe the needs assessment, the partnership development, and of course the collaboration plan designed to meet the healthcare training needs of our community. Without further delay, I would like to introduce you to our board chair, Mr. Bob Beaver.
Thank you, Bobbi. I've been serving on technical college boards for over 35 years, the last 30 with the board of directors at Mid-State, and it's a pleasure to serve as the current board chair. Over my time, I have witnessed post-secondary education change in many ways. One way is how technology can provide a more meaningful and comprehensive way to teach and learn, better preparing students to enter fields with industry-ready certifications, licenses, and skills. With the WTCS mission of skills training that recognizes the rapidly changing needs to the current workforce demands, as well as our mission to transform lives through the power of teaching and learning, we are continually bringing a state-of-the-art technology and innovative ideas. This project does just that. However, I consider this project a legacy project, a project that will leave its mark on our students, our colleagues, our partners, and our community for many years to come. A project that through innovation and collaboration and trust between the college, the hospital, and the local charitable foundation, our community will reap the benefits. I hope this project will inspire you to collaborate and innovate with your stakeholders as well. I would like to thank all of our administrators, but certainly our current president, Dr. Shelley Mondyke, and I'd like to welcome her.
Good afternoon. For the past 3 years, I've had the privilege to serve as the president of Mid-State Technical College. I'm passionate about our mission of transforming lives through the power of teaching and learning. And because of this, I was very concerned when I heard that, like other areas around the country, the Mid-State District was expected to have a shortage of healthcare providers. I knew our solution-minded college could help remedy this shortfall if what I was hearing could be assessed and validated. The first thing we did was organize a mid-state team to collect and organize the data. The assessment showed that we did have a shortage that was going to get deeper over time. But at the same time, our college has significant waiting lists for some of our healthcare programs, mostly due to the shortage of clinical slots necessary to deliver our programming. So we had people wanting to come into our programs, but no way to increase our capacities. We also found that simulation integration within educational training programs was becoming an important key in meeting the increased need for our graduates. High-fidelity simulation in nursing, for example, now may be used for up to 50% of all clinical courses. As we finalized our assessment, we also learned of the needs of local professional development opportunities by our incumbent healthcare professionals, as well as education and training needs for our local communities. The assessment was compiled into a white paper to guide the future steps of identifying partners to bring an interdisciplinary healthcare simulation center to our college district, allowing us to double some of our capacities in our healthcare programs. While we have numerous reputable healthcare provider partners in our college district, one partner had been extremely collaborative over the past 3 decades, Aspirus Riverview Hospital. Aspirus Riverview Hospital participates in 7 of our program advisory committees, guiding the relevancy in our curriculum. They also provide 7 clinical and practicum sites for our students in our health programs and provides instructors for specific mid-state health-related courses. They support our students with scholarships, they hire our graduates, and they participate in our college foundation events. Who better to explore the opportunity with? Aspirus Riverview Hospital. They were clearly a strong, committed partner, and as you may have guessed, Aspirus Riverview Hospital was clearly interested, and they offered their soon-to-be vacant 3rd floor to create a state-of-the-art interdisciplinary healthcare simulation center. The partnership was strengthened with a collaborative grant and funding from the Legacy Foundation of Central Wisconsin. This new interdisciplinary simulation center, located within a real working hospital setting, will provide student simulation training, incumbent workforce training, and most importantly, community training. With the data-driven assessment leading to a conclusive solution and identification of partnerships and funders, the collaboration plan began. But before hearing about the details of the plan, I would like to hear from one of our partners. Welcome Chris Steins, CEO of Aspirus Riverview Hospital and Clinics. Let's take a drive over and talk to him now.
Good afternoon. My name is Chris Steins, and I serve as the president of Aspirus Riverview Hospital and Clinics. Our mission is clear at Aspirus. We heal people, promote health, and strengthen communities. When the opportunity to partner with Mid-State Technical College on innovating a new space to prepare for healthcare professionals and provide community health promotion education, it was an impeccable fit. A new simulation center would play a vital role in helping us achieve our mission for many years to come. After over 3 years of innovative discussions and planning meetings, the Mid-State Healthcare Simulation Center, in partnership with Aspirus Riverview Hospital, is well underway. There are many highlights of why this project is a fit, starting with the excellent relationship that Aspirus Riverview has enjoyed with Mid-State Technical College for several decades. In fact, many of our current employees and several members of our team have earned their degrees from Mid-State. Our shared history and commitment to the community make our partnership on the new simulation center even more rewarding. As you all know, the nation has an immense need for well-trained healthcare professionals. Our communities here in central Wisconsin are no different. And as our current healthcare workers retire and our population ages, that need is growing more concerning every day. The new simulation center will have a substantial impact on our community's ability to meet the demand for well-prepared, highly trained healthcare professionals in a wide array of fields, including registered nurses, certified nursing assistants, medical assistants, phlebotomists, respiratory therapists, surgical technologists, central sterilization technicians, EMTs, and paramedics. In addition to educating the healthcare professionals of tomorrow, the new Simulation Center will also be a place for continuing education for our own Aspirus Riverview staff and for many other healthcare professionals from throughout our community. The high-tech mannequins and other equipment in the Simulation Center will replicate nearly all clinical scenarios, the common and the rare. This means that those training in the center will be able to practice recognizing and responding to medical emergencies on demand rather than waiting for those scenarios to occur or perhaps never occur during their traditional clinical rotations. The Simulation Center will also provide students with a safe, consequence-free environment for honing their skills and to try again and again until those skills are mastered. The realistic training and practice students experienced in the center will sharpen their clinical thinking and decision-making skills and will enable them to care for their future patients with competence and confidence. Like all hospitals, Aspirus Riverview is challenged with attracting enough highly qualified nurses and other healthcare professionals to meet the needs of our community. The new Simulation Center will help Mid-State attract and educate more students than ever before, and many of them will complete their education in the Simulation Center, right here on our Aspirus Riverview campus. We are hopeful that their time on our campus will give these students a taste for the Aspirus culture and inspire them to join us as fellow Aspirus team members upon their graduation. With the exceptional education and training we know they will have received, we will be delighted to welcome them to our team. Finally, this project would not have happened without the support from Legacy Foundation of Central Wisconsin. I would like you to hear from Mike Bobbi, Executive Director.
The Legacy Foundation was formed in 2015 from the proceeds of the sale of Riverview Hospital Association. As is indicated by our name, our founders wanted to carry on the legacy of our community-owned hospital and made it our mission to continuously improve our community's health and well-being. To accomplish that, we look for projects with a measurable long-term impact in the areas of physical, emotional, intellectual, and societal well-being. Ideally, we like to partner with strong and compassionate organizations working in collaboration. Looking forward in time, we know that the need for healthcare services will continue to increase as our population ages. Simultaneously, the healthcare industry expects to see a large number of worker retirements. Unless we did something significant, the result would be a shortage of healthcare professionals. Creating a state-of-the-art simulation center seemed like the perfect solution. We couldn't think of a better partnership than a collaboration with Mid-State Technical College, our community's healthcare educator of choice, and Aspirus, our community's healthcare provider of choice. Through this partnership, our college will attract and train the next generation of healthcare students. Our hospital will have access to much-needed healthcare professionals, and our community will get highly trained caregivers. With this project, everybody wins.
I am Dr. Deb Stencil, Vice President of Academics at Mid-State Technical College, and I would like to introduce you to a few members of the collaboration team. We would like to share with you the inspiration and details of the Healthcare Simulation Center. With me today are Dr. Colleen Kane, Dean of Health at Mid-State, and Dr. Kim Johnson, Vice President of Patient Care and Chief Nursing Officer. We, as well as other members of our team, have been meeting regularly over the past 3 years, developing the floor plans, guiding the innovation in construction, discussing the budgets, and collaborating on the operational details of the center. We started with a small Mid-State Aspirus team to develop the possibilities of what the center could be, and then transitioned to a diverse team of education, healthcare, IT, facilities, engineers, and construction experts to design a simulation center that would meet the needs of our organizations and the community. Currently, we are meeting weekly with the construction team and weekly as an internal Mid-State team to ensure that we are aligned and ready for each stage of the construction process. Now I'd like to turn this over to Dr. Colleen Kane and Dr. Kim Johnson to share with you their inspiration and vision for this project.
Hello, I'm Dr. Colleen Kane. Before I begin, I'd like to show you a brief video clip which reflects the vision that we have developed together as a team. I would like to share with you our goal, which was to create a state-of-the-art simulation center that would combine education and inpatient features. But that is really what makes this center unique. Having an educational simulation center located in a community hospital. We also needed to ensure it provided relevant learning experience for nursing and allied health programs, including nursing assistant, medical assistant, surgical technologist, central service technician, phlebotomy, respiratory therapy, and our emergency services programs like EMT and paramedic. Because the unit was a previous family birth center, it included nurses' stations, inpatient rooms, a viewing area which was a nursery, and a surgical suite. It was easy to walk through the unit and see how these rooms could be transformed into simulated inpatient rooms, exam rooms, classrooms, student lounges, phlebotomy lab, a surgical and central service room. The simulation center includes 2 patient care wings. One wing is designed for inpatient care, and the other is focused on outpatient care. These patient care areas include 2 classrooms, which mirror classrooms on our campuses. These classrooms contain movable furniture to provide flexible learning spaces and the same color schemes to give the students the feel that they are on a mid-state campus. They include innovative and interactive classroom technology, including sign-up and telepresence, which allows students to participate in learning experiences from another mid-state campus. The unit will have 5 high-fidelity simulators and 4 medium-fidelity simulators. Fidelity applies to both the psychological and physical aspect of simulation. While the learning space and exercise contribute to the psychological reality to the trainees, the mannequin contributes to the physical reality. A mannequin is a human-like simulator used for healthcare simulations. The fidelity of a mannequin relates to the degree to which a simulation experience approaches reality. The inpatient wing has high-fidelity simulators with adjacent control rooms. The inpatient wing will be used by paramedic, EMT, respiratory therapy, and nursing students. The outpatient wing consists of 4 exam rooms, a phlebotomy lab, and a surgical suite. The outpatient wing has medium fidelity simulators with 4 control stations. The outpatient wing will be used by medical assistant, surgical technician, central service technician, nursing assistant, and phlebotomy students. The simulation center has 3 debriefing rooms, which will allow students to review and critique their performance and receive further guidance from their instructors. A student lounge is positioned in the center of the 2 wings, providing students with an opportunity to utilize computers, prepare for simulation experiences, or have a snack while waiting their turn to participate in a simulation scenario. The simulation center also includes nurses' stations and a medication room, which will allow learners to retrieve and prepare medications for simulated medication administration. Lastly, there is an anatomy learning lab with a high-tech anatomage table. This resource will allow instructors to reinforce body systems and functions learned in previous courses during the learner's simulation experience. And now, I would like to turn it over to Dr. Kim Johnson.
Thank you, Dr. Kane. When I began my role at Aspirus Riverview, I soon learned of the proposed simulation center. I could appreciate the space constraints which Mid-State was experiencing and recognized this would be an ideal opportunity to support expansion. As we collaborated early on in the project, it became apparent that we, as a hospital, would benefit by having a simulation center located on our campus. First, it's a recruitment strategy. Having approximately 100 students a day entering through our doors gives them the opportunity to become familiar and comfortable within our hospital setting. Our current nursing workforce at Aspirus Riverview Hospital is aging. Nearly a third of our workforce is over 55 years of age. We are hopeful that by having more students learn locally, they will stay local. Also, as an employer of healthcare professionals, we are excited that there will be high-tech simulation training, as this should assist in narrowing the competency gap between academia and practice. Secondly, this center would not only support students and future Aspirus employees, but also current healthcare employees working at our institution. At the hospital, the majority of our staff education is provided online with very little hands-on opportunity. With this state-of-the-art simulation center located within our hospital walls, our staff will have access to this center for competency and remediation training. Since adults are experiential learners, this hands-on learning environment should result in increased staff engagement and increased retention of critical information. We will be able to run interdisciplinary scenarios involving the interdisciplinary team, which includes our providers, our nurses, our respiratory therapists. We will run scenarios that are high risk and low volume, such as patients declining rapidly due to sepsis shock leading to a code blue. By increasing the quality of care provided in our community, we will be able to keep more patients at our hospital versus transferring them to an unfamiliar hospital in an unfamiliar community. This certainly is a win-win opportunity for Aspirus Riverview staff, Mid-State students, and the patients we serve.
To wrap up the story of innovation, collaboration, and partnership, I would like to share that our partnership included some legal and organizational instruments and tools. The devil is in the details, they say. The Mid-State Healthcare Simulation Center, in partnership with Aspirus Riverview Hospital, is secured by a long-term lease. This multi-year lease has been scaled, so monthly payment amounts for the Healthcare Simulation Center space for the first 2 years were discounted to provide ample time for Mid-State to ramp up in a thoughtful way, providing quality teaching and learning throughout the project. Additionally, a memo of understanding between the parties was implemented, addressing expectations for operational matters, including student expectations. An oversight committee made up of 3 employees from each organization will continue to meet on a regular basis, ensuring the outcomes and expectations of the project are met. After nearly a 6-month COVID-19 delay in construction, the facility work is back underway. We look forward to starting classes at the Mid-State Healthcare Simulation Center in January of 2021. We hope you have found our project interesting and that it may provide you with some inspiration to find your mission partners, moving important, meaningful projects like this forward in your communities. We would like to address any questions you may have, and thank you for your attention.